All right, welcome to another episode of the Bioinformatics Lab podcast. I'm Kevin Libwitt with Andrew Page. We're from Theogen, and today we're going to be talking about public health responses to emerging infectious diseases. This is something we are, of course, at this point, no stranger to around the world. But this, with respect to the COVID-19 global pandemic, we all saw public health at the front lines of really all of our lives, in the media, in our personal lives, etc. But these continue to be emerging threats around the world. This is something that's always on the mind of public health scientists and microbiologists alike. And even, most recently, in the face of the mycoplasma conversation and emergence of those spikes of infections across the world, there's always the conversation of what does public health response look like? And so hopefully today we can give a little bit of insight into what's happening on the laboratory side. What is the perspective of infectious disease microbiologists on the bioinformatics and preparedness front to give some a bit of a picture of what this world looks like? And obviously both you and I have some experience in this with COVID-19, but really, again, many years of experience of hearing these threats kind of emerge across the world, across our careers, and we see these kinds of conversations murmur about pretty much every year.
Yeah, absolutely. And I guess, as you mentioned, what spawned this conversation is, news articles declaring white lung in children as like the next big problem. And it is in China, and it is a problem, obviously, because people become severely ill. And that's mycoplasma pneumoniae.
Yes.
And sorry, I'm terrible with names. But also it's been renamed to mycoplasmoides pneumoniae, which is just going to confuse people because databases are going to come back with totally different things. And if you look at both of them, they are totally crazy and no one has any consensus because it's a new name. Taxonomists should be banned from changing anything because they like to fiddle around, and then they rename something that happens to become important. Anyway, so it's come about because of that, and then I've seen more articles recently, and I think there is an increase in cases in Denmark. Now, the thing is, these things come up all the time, and what people worry about is, has there been some change to the organism, which is causing more severe disease or more drug resistance, or something which is just really worrying, or is it spreading faster? And that's always the top of our mind. And actually, the worst ones are where they don't know the causative agent. Is it a microbe? Is it a virus? Is it some kind of chemical contamination? There's so many different things it could be. And it's those first few days where people really really worry when there's something is recognized. But thereafter, the public health response kicks in as if it's a microbe, and people get to work. And you could see with, say, COVID-19, where they did shotgun sequencing on people who were in intensive care, unexplained cases in intensive care. And they found, there's, SARS-CoV-2, or what we now know of SARS-CoV-2, or coronavirus. And they're like, oh, that must be it. We haven't seen this before. We know it causes disease in humans. It's a problem. And but there is a set of steps, that public health around the world always think, when something new is emerging. And Kevin, you've worked in public health in an actual lab, on the front lines.
Yes.
And so you should probably have a better idea than I do.
Yeah, I got a perspective of this too, even how my experience at the public health lab has translated to my own lens of whenever I'm hearing these news stories and whether or not, okay, is this going to be something or is this not going to be something? And, to hedge all of our conversations, we ultimately don't know, right? It can also, there's always the non-zero probabilities that we're wrong. But I think the lens I tend to look at these, the news stories of the potential outbreaks is looking at maybe three pillars, I would say, at least the three that most readily come to mind. And that's looking at it in terms of the novelty of the pathogen, the pathogenicity. So like, how it's actually infecting and the severity of illness, and then transmissibility. And so whenever these most recent cases of mycoplasma were emerging, in looking at all three of those categories, it ranks relatively low. It's not novel really at all. In fact, we have very defined medical responses to this infectious disease. It's very well characterized, and it's something we know well in the community. In fact, every year anticipate the emergence of this disease. in terms of pathogenicity too, as well. This is not something that's, I think maybe in Southeast Asia, they were talking about a little bit more of the severe cases, but even in those cases and instances, it's not a terribly severe illness. And, again, as things continue to emerge and move on, maybe we'll see something different, and that would cause a bit more concern. But I think in general with mycoplasma, it's it goes often unreported even because it's such a cold-like symptom, and people will maybe stay in bed and then are able to rid themselves of the disease even without medical treatment. And then also in terms of the transmissibility, right? This is also relatively low, where there is some conversation of current spikes of this disease, but it's nothing that would necessarily cause concern. But so like with that frame of those three categories of novelty, pathogenicity, and transmissibility, taking us back to March or rather maybe December of 2019 into the spring, early years or early months of 2020, novelty was super high. The pathogenicity was a relatively unknown, and we didn't know how intense it was going to be. We were seeing kind of various reports, and then the transmissibility was like off the charts. So that's when it was like, this is something that's like, whoa, we don't know how crazy this is going to be. And that's where the alarm bells started ringing. So, and then we were approaching all three of those fronts to try to know more about it. In terms of the novelty, we all started sequencing it so we could better understand what the heck is this disease, what are the key factors, what are we looking at? Okay, we're looking at the spike protein and the ways in which it's mutating over time. Transmissibility, you saw all the different data trends that were being tracked by the epidemiologists around the world. And then the transmissibility, we were trying to curb as much as possible with all the non-pharmaceutical public health interventions that we had at our disposal. So that's more or less the mindset that I have when I'm reading these articles. Okay, is the novelty, how novel is this? How well are we equipped and to understand and to combat this disease? What is the severity of the disease in terms of its impact on patients, and how quickly is it transmitting across localities and even internationally with travel and things like this?
But then as bioinformaticians, I know one of our colleagues, did the first thing that most of us would do is to test, do our pipelines work absolutely with the definitive type strains, for this, and then going and mining in the public archives, like, is there any recent data? Does it work with that? Just double checking. We know in our hearts that absolutely will work, because it's, why wouldn't it? It's just another bacteria that we work on. And so we knew it should work, and it was just a double check to see and to confirm, yes, it does work. And we've done all these extra tests to, reassure ourselves that we can, say, assemble it, we can call AMR from it, we can do whatever we need to do to detect it, so that if someone goes, actually, this is a problem, we know absolutely, yeah, we can spin it up immediately and be confident in the results.
Yeah, and I think that speaks to this particular outbreak or this particular pathogen, again, to the novelty. It already, we didn't have to modify any of our current tools, at least when I say our, I mean, like on the Theogen side, our Theoproc workflow using the Gambit database based off RefSeq, it was already in there. We had never come across these types of data, but it was already something that kind of is in the established literature and the established databases where it is pretty well known. So that's where, when I'm looking at this current conversation of mycoplasm, I'm watching the trends, but it's not like I've got alarm bells ringing and like, okay, I'm thinking about, we got to stock up for another big one or something like that. But, again, you and I have seen these kinds of conversations ebb and flow. So I don't know what the lens you look at these kinds of conversations at.
Yeah, I've seen many different scares and unknowns over the years, and they come and go. I mean, obviously viruses are more of a problem because you don't have antibiotics there to help you. When obviously flu being a new novel flu being the worst offender usually, obviously not recently coronavirus. And like a few years ago, I remember there was a beta coronavirus, which is now called MERS, Middle Eastern Respiratory Syndrome. Yes. And then you had SARS as well. And, there's a lot of hoopla over those. Luckily, they didn't cause widespread problems. I say MERS, it was more people who were severely immunocompromised were made severely ill, but it didn't cause problems in the community. And then SARS, obviously, I think they did a study about a year or two after it came out, and they found basically everyone in the world had antibodies to it because it just spread so mildly that no one even noticed. And then we had Zika, which obviously is a big problem for a little while, particularly microcephaly. But But again, that fizzled out very rapidly. And it's these kind of things. And monkeypox, actually, I remember that kicked off just as we were finishing COVID sequencing in my group. And we were like, oh, great, another major problem. But at the time, I remember reading, the longest chain of transmission ever for monkeypox was 6 individuals, so 6 jumps that have been recorded. So, which isn't very much. And it appeared to be it so happened to get into a population where it could expand, but it didn't expand beyond that. And of course, there is an effective vaccine, public health interventions, and awareness seemed to just put a cap on a lot of it. And then it ran through the susceptible population very rapidly, and then it stopped more or less, and something that would have been a big concern about a year ago is now like not even on the radar.
And that's what's super difficult about our field is the communication of the nuance, because it reaches the broadcast of huge media, and it feels like all the little blurps that may be like kind of yellow flags get super sensationalized to everything is a red flag. And so it's hard for if you're outside of our field to delineate what are the true threats versus what's likely not a threat, because they all get reported as this is going to be the next thing. Like if you see some of these articles on mycoplasma, even to give it that really scary moniker of white lung disease or whatever it is, I've never heard it described like an infectious disease of the lung described in that way, because I guess presumably they'd all be white lung in that they'd show in the imaging there. Yeah, but so I don't know if that was a product of journalism there, of modern journalism, to give it that moniker, and maybe that helps to some degree of increase awareness. But I think it may also have the unintended consequence of people just starting to filter out the noise. So and you saw that a little bit with SARS-CoV-2, where it was like, these guys were talking about MERS last year, they talked about Zika, they talked about this. It's just the public health people freaking out about this. But it's often not. It's often public health folks being like, hey, this could potentially be concerning. We always speak, even in this conversation, I always catch myself of, we're always kind of hedging our conversations because we're trained as scientists with levels of uncertainty. But that doesn't necessarily translate whenever you're trying to communicate out the story to the non-scientific community. So that's always been a major challenge, especially in the face of these emerging infectious diseases.
It's a nuance that's important. And like you and I will know, let's say for most bacterial infections, you can just give antibiotics, it's going to work. And you can see scary headlines and whatever, but actually there is often very simple cures that are widespread and effective. And the fact that it's causing problems in people, it's just because there needs to be just more widespread appreciation of that this is a problem to be tested for, not that it is something where we need a novel new treatment. With viruses, obviously, that's a totally different problem. So about a year and a half ago, there was an issue with a lot of children in the UK, or there's a few dozen children in the UK needed liver transplants in an emergency. And they suspected it was caused maybe by, say, hepatitis E, or they had some other theories as well. And it basically boiled down to, they think what happened was just because of lockdowns and restrictions, that a lot of people didn't have any natural immunity to circulating infections, and it was kind of a stored up crisis. And then, of course, when everything was removed and all the normal pathogens started spreading, then susceptible children, unfortunately, were getting severely ill and needing transplants. So it was more of a delayed rather than a new thing. But that caused a lot of problems for a long time because people didn't know what it was. And obviously, when damage has been done to the extent, say, that you need a liver transplant, that's too late down the road to, pathogen is probably long gone from your system.
Yeah.
Yeah.
Yeah, those kinds of impacts of I forget the language people are using there, but sort of an immunity debt, like when you're locked up for that long, you're not exposed to the same pathogens, you don't have that same robust immunity, and you see that population wide. And I think to some degree that is often what people are attributing to the mycoplasma spikes as well, where especially on young children who would be more susceptible to these kinds of diseases. And so it's an unfortunate but to some degree predictable trend that we're seeing with some of these infectious diseases after the post-pandemic world that we're living in here.
Yeah, it's unfortunate. And unfortunately, we're going to have more of these false alarms
Yeah.
probably 10 or 100 to every actual real endemic or pandemic disease. And yeah, this is par for a course.
And that's why I feel like actually having these kinds of conversations and putting these out there, it's not like we have a crazy wide audience here, but I hope more of these kinds of conversations can start happening. I think there is general thirst for the nuance of things where people are going to want to know, hey, if I see this crazy headline, is there a balancing weight in the scientific community that can help curb this? Or is the scientific community also meeting that same level of alarm that, wait, this is going to be something,
I guess within public health, there needs to be that extra capacity there, right? So that if there is something emerging, you can actually kind of investigate it and potentially stop it. Because, there's a routine day to day and that everyone needs to do, and, all the routine pathogens you need to keep an eye on. But actually, you do need that extra sliver of essentially research time, to make sure that you can actually dig into signals that you think might be a problem or it might not be a problem. And sequencing goes a long way to help that, because you can do, say, metagenomic sequencing, even 16S or shotgun can help quite a lot in that regard.
And that's one thing, at least I could definitely speak on the US side, that we have created during the pandemic, the public health and academic and even private partnerships that are still relatively strong, so that you have that sliver of capabilities of exploration and deeper dives in understanding the novel threats, while the public health labs is kind of routinely doing, their day-to-day public health tasks, which is often, already taking up most of the bandwidth there.
Absolutely, yeah. Anyway, this has been a great discussion, and hopefully we won't have another new emerging pathogen next week.
Yes.
But thank you very much, and we will talk to you all next week.